Did you know the average healthcare data breach now costs an astonishing $10.9 million? If you're still redacting medical record PDFs manually, line by line, then you are sitting on a massive compliance liability. Welcome back. Today, we're breaking down exactly how to redact medical records efficiently and legally. In this video, we'll cover the strict 2026 regulatory updates, the specific scenarios where redaction is legally required, and a flawless 5-step workflow. Stick around to the end to see how AI-powered redaction software for healthcare minimizes human error while saving you hours of tedious work. Redacting medical records is mandated by a strict web of overlapping laws, including HIPAA, the HITECH Act, FOIA, and GDPR. The HHS Office for Civil Rights is actively expanding enforcement, and just this year, their focus shifted from mere risk analysis to a more proactive risk management. And that means that you not only have to identify where PHI exists, but also show that you're actively protecting it. And if you slip up, Tier 1 civil penalties can now reach up to $73,011 per violation, with criminal penalties topping $250,000 and prison time for malicious harm. Comment below, has your organization migrated to automated compliance tools yet? Or are you still feeling the friction of doing things manually? Under HIPAA's Safe Harbor method, there are 18 specific protected health information identifiers that you must remove from PDF. And this goes beyond names and social security numbers. For instance, did you know that all elements of dates except the year must be completely redacted? A specific date, say January 15th, 2025, must legally simply become 2025. You must also redact third-party details shared by relatives, sensitive data likely to cause physical or mental harm, and the highly protected categories like 42 CFR Part 2 substance abuse records or isolated psychotherapy notes. To execute this securely, follow this 5-step process. First, scan or upload your medical PDFs into CaseGuard. Second, give a quick scan of your document for all the PHI that you need to redact. Third, direct the AI to scan and redact all instances in a matter of moments. Fourth, run a manual quality assurance check just to make sure redaction reasons were applied, false positives are at a minimum, and last but not least, export your secure document. While automated PDF redaction software dramatically speeds up the release of information cycle, combining it with human QA satisfies the legal requirement perfectly and guarantees that you have remaining re-identifiable data. If you're tired of line-by-line redaction eating up all of your time and putting your organization at risk, head on over to caseguard.com right now to book your personalized demo. Protect your patients, secure your litigation data, and save your sanity. I'll see you in the next video.